Dr. Foojan, Zeine, and welcome to the Inner Voice Show, the show that's about you and your life. And we talk with experts about the matters that are most important to your life from a psychological perspective. So today I am so excited. First of all, I have a great friend and a colleague with me in studio, and then a master of a theory and emotions on Skype. And I'm just very excited to have the opportunity to bring this wonderful human being who has created so much wealth of information and experience to the psychology world to you. So first of all, I want to introduce Ladan Safvati, who's one of our therapists from Personal Growth Institute, and we've worked very many long years together, to all of you. So welcome.
Thank you so much, and thank you for preparing this opportunity to have this wonderful researcher with us.
Absolutely. So the most important thing where I know that Ladan Safvati, who's also a marriage and family therapist, and works together in many of the different type of theories. And one theory she just fell in love with, and she's been bragging about it all these years, and together finally she was able to bring the originator of this theory to us. So can you tell us a little bit about Dr. Greenberg?
Yes, of course. Dr. Greenberg is the Distinguished Research Professor of Psychology at York University in Toronto. He is the primary developer of emotion-focused therapy for individuals and couples. He is the director of York University Psychotherapy Research Clinic and the Emotion-Focused Therapy Clinic, and one of the world's leading authorities on working with emotions in psychotherapy. He received the 2004 Distinguished Research Career Award of the Society for Psychotherapy Research. He is recipient of the APA Award for Distinguished Professional Contribution to Applied Research in 2012, and also the Carl Rogers Award of the American Psychology Association Society for Humanistic Psychology. And I'm sure there are more that we don't have time to cover all of them. Dr. Greenberg has published extensively on research on the process of change. His research includes 112 articles in scientific journals, 88 book chapters, and 21 books. Dr. Greenberg has his private practice in Toronto, Canada, and travels the world to train psychotherapists in emotion-focused therapy.
And so welcome, Dr. Greenberg, from Mexico, from northern United States to the South America. So welcome, and thank you for giving us the opportunity to be with us.
Thank you.
Dr. Greenberg, one of the most important factors that I was reading is about emotions, and the name of the theory is emotion-focused theory. And then in the world of cognitive theory, and then first behavioral, and then a cognitive theory, there was always a space that was needed to be focused on. And I know when the Rogerian era came, there was a lot of focus on experience, but not necessarily all the emotions. So tell us about how you came about in focusing on the emotional aspect of human being in the psychology world.
Well, a lot of it came from, actually, I'm a research psychotherapy researcher, so I was studying tapes, and I really observed that and in my own training, that when people got more emotionally engaged, the change was more significant. And so, I mean, that's really the key. But also, I was an engineer before I was a psychologist. And there I was struck with a phenomena that I always knew more than I could say in solving math problems. So I was always interested in that there's another source of knowing, which isn't your cognitive conscious knowing.
So what you're saying is that there's a different access to the knowledge that a human being has from inside, and that becomes the access.
Yes,
right?
Yes.
Right. We're wiser than our intellect alone. So just what we think and articulate in language, it's like the brain has two languages. One is symbolic language, where we talk and it's conceptual, but the brain has a second language, which is expressed through the body, through what we feel. And so it's an emotional language, and it has information, and it gives us an important orientation towards the world.
So most therapists, or at least a lot of therapists, are working really hard to eliminate the bad feelings of the clients. Like, for example, people come to us with anxiety, with depression, and we try so hard to eliminate the sadness, the fears, all of that. What is emotion-focused therapy approach to use of emotion or eliminating emotions?
Yeah. Well, see, firstly, I think the issue is we have to make distinctions between different kinds of emotion. So one of the very first principles of an emotion-focused approach is to distinguish between primary or gut feelings and secondary or symptomatic feelings. And also there's a third one, which is instrumental or manipulative feelings. So the feelings that other therapies are often trying to eliminate or modify are often secondary symptomatic feelings. So if someone comes in with anxiety, usually that's a symptom of something else. And they're usually anxious because underneath they feel maybe sadness, maybe shame, maybe anger, and they're not able to deal with that. They're not aware of or acknowledging that. And then this leads to a secondary reaction of feeling anxious. So we try to get to the more primary feelings rather than acting to modify the symptomatic feeling. We try to get to the more underlying primary feeling, which is really the cause of the symptom.
And how do you distinguish between the primary and the secondary emotion? What would you call a primary versus the secondary or the surface ones?
Well, the primary emotion is one that helps you deal with the immediate situation. And once you've dealt with the situation, it goes away. So fear and these primary emotions are adaptive. I mean, we're born with an emotion system that's adaptive. So if there's a threat, you feel like if you're walking down a dark laneway late at night and you have footsteps behind you, you feel fear, and that organizes you to get away or to protect yourself. That's a healthy adaptive emotion. But feel fear in a situation where it's not going to help you, but you feel anxiety, if your boss raises his voice and you begin to feel afraid and anxious, that's probably because in your history you had some kind of more traumatic feeling, say an abusive father, and so it was adaptive to feel fear of your father's violence, but it's not adaptive to feel afraid when your boss raises his voice. So it takes clinical judgment, it takes some knowledge, understanding of human experience. But the most standard that most people understand is that often all people, when they feel hurt, they express anger.
Yes.
And in couples, often people are expressing the anger to each other, not the underlying hurt.
So in your trainings, you teach psychotherapists how to distinguish between primary, secondary, adaptive, and maladaptive emotions. So you have a system to teach them, basically distinguish between them.
Yes, I mean, you teach them both conceptually but also experientially, so that you have to learn to identify yourself as one of the real important ways of identifying with other people. But yes, it's an important part of the training is to distinguish between different kinds of emotions, but then how to respond in different ways to different kinds of emotions.
Would you be able to do it for yourself as well?
But we need to also see you. I think we only see your hand at this point. If you can please turn toward the camera. Can you turn toward the camera? There you are. We'd love to see your face. There we go. I know that you don't see our face, so it's more like you're on a phone. But we do see your face, and your audience sees your face. And what your question was is there a technique that the person can also do this for themselves to have an awareness? And I know that part of what I read in here is in your book, emotion-focused therapy. It says that this type of therapy promotes awareness, acceptance, expression, utilization, regulation, and transformation of emotion, well as a corrective emotional experience with the therapist. And then it strengthens the self and the regulating affect and the way that we create new meanings for it. And I think Ladan was asking, is there a way that a person can also do that for themselves? Do they get the technique and are able to do it as a self-help?
Well, the first part, I talk about in that you read out, the core process. I talk about it as arriving and leaving, right? And that you have to arrive at a place before you can leave it.
Right.
So you have to arrive at painful feeling in order to change it. So the first part, arriving, is about awareness and acceptance and symbolizing. That you can all do yourself. The leading part, the transforming, having the corrective emotional experience, is difficult to have just on your own. I mean, it is possible, but it's unlikely. You need to be in a relationship and either have a corrective experience with a partner in the world or with a therapist. All the therapist needs to help you to get to a new feeling. It's not so easy to do on your own.
So here comes the role of the therapist, and also how skilled the therapist is in facilitating that and practicing emotion-focused therapy.
Right.
So if people wanted to choose an emotional focused therapist, what would they experience that would be different than them choosing a cognitive behavioral therapist? So for the audience who are looking to choose a therapist, what would you suggest?
You're asking what would the experience, if you like, that would be different?
Yes.
Is that correct?
Yes.
Well, firstly, I mean, in an emotion-focused therapy, you're actually going to deal with your feelings. You're going to have to face this painful feeling, but with a lot of support from the therapist. In cognitive therapy, it's more cognitive. It's reasoning, it's trying to think more logically or change your beliefs, but it's not nearly as emotionally based as the body. And my belief is that unless you get to the deepest level of painful emotional experience, it's really not going to change. You can't really change our core fears and our core shame by reasoning. We have to really feel the feeling. And then we have to have a corrective emotional experience of having another feeling that helps us change our more painful feeling. I mean, they're two different parts. One is sometimes people just have difficulty acknowledging what are essentially healthy adaptive feelings like blocked breathing. There, the therapist helps you to breathe and to accept your sadness, and then that therapeutic and change producing But the second part is often where you have symptomatic feeling like anxiety or fear, and then the therapist goes to a deeper level, which often takes you back into your childhood, and you get to say, of course, shame, I feel worthless, I was told that I was worth nothing, or I feel very insecure about being alone, very lonely because I was abandoned as a child. And those are very painful feelings. But just feeling them alone is not going to help you change. You actually need to revisit that place and now create a new experience. You feel more deserving, you feel deserving of protection, or deserving of value. And then that new feeling helps to change the old feeling.
Yeah. So the experience of experiencing the emotion, feeling the emotion, and going through it by itself, and then shifting the thoughts that are around it is also what creates the healing, as I hear you, right?
And changing the feeling. Changing that feeling.
The feeling of a new feeling. So you have to have a new experience, and that helps you change the old experience. And a therapist is there to help kind of coach you into having a new feeling. So if you have an alcoholic, abusive father, usually your gut response, your amygdala base, which is the sort of very rapid emotion-producing part of your brain, reacts with fear.
Right.
And if you imagine your father sitting in front of you, you immediately shrink away to have fear. And if I can help you to experience empowered anger, being more assertive towards your father, or if I can help you even squeeze the loss of protection that you really need, this new feeling of anger or sadness begins to change your feeling of fear. And in fear, you're organized to run away. In anger or in sadness, you're organized to thrust forward or reach out. So you're more organized to approach, where the other you're organized to withdraw. If I can help you feel a new tendency, it's going to change your old tendency.
And is it the therapist that offers the new emotions to feel, or is it that as the client goes through the automated feeling that they've experienced and they go through, and as they experience new experiences, then the therapist reflects in all of these new experiences and emotions that they're experiencing?
When we talk about a combination of following and guiding, so the emotion comes from the client, but they get there by being guided by the therapist. So the therapist is like a good coach, draws out what's possible for the client. In particular, the therapist is like a sculptor who brings out of the stone what's possible. So it's a complex process, but it's not what you're supposed to do on your own, is that usually you don't go there on your own. So somehow there's a guide who's helping to point the light, but doesn't create the feeling. It helps you pay attention to parts of yourself that eventually help you feel a new feeling.
For example, with the example that you brought up, is that the child of an alcoholic father has some anger and sadness inside, along with the fear, and the therapist helps the client focus or emphasize more on the anger and or sadness, and that anger and sadness would transform the fear.
Exactly. So in the first instance, the child has these more adaptive emotions. But at the time, it was adaptive to be afraid and to try to hide. But they also did feel anger because they were being abused. But it wasn't safe to express that. So that is somehow embedded there as a possibility, but one that hasn't been developed. And you try to help them develop. So in some way, you're helping the people grow or develop parts of themselves that have been blocked or stunted.
So can we summarize in short that the difference of experience between cognitive behavior therapy and emotion-focused therapy is that in cognitive behavior therapy, the therapist is trying to change the way you think, to change the way you feel, but in emotion-focused therapy, you change a feeling with another feeling.
Yes. And also, originally cognitive therapy took a very strong position that your thoughts create your feeling. And in emotion focus, I take a strong position that actually your feelings precede your thoughts. When I feel angry, I have angry thoughts. When I feel sad, I evoke sad memories. And that's the primary way of being in the world. Our thoughts do create secondary feelings. Like if I think my plane is going to crash, I do feel afraid. But the issue is, why am I thinking that my plane is going to crash? I'm thinking my plane is going to crash because I'm separating from loved ones, and that makes me feel shaky and insecure. And that's my primary feeling. So really, I believe that my feelings lead to my thoughts much more than my thoughts lead to my feelings. And it's shown that
you stated that in a sense people have primary and then the secondary, but in the essence of beside all of the joyous feelings and emotions, when people want to go toward some of the primary emotions that are a little bit more uncomfortable, such as fear, powerlessness, shame, many of those emotions, they're used to trying to get out of them or numb them, and that's many times where addiction shows up, is because they want to numb all of those emotions. Why is it that people are so afraid and uncomfortable with such a natural part of their system, which is emotions?
Yeah, this is a profound question, really. Why people, I've traveled all around the world and really explored this, and in all cultures, people basically are afraid of emotions and distance from it. And in the more collectivist Asian cultures and more Eastern, their meditation is used, but it's still distance from emotion and observance. And then in all cultures, their practices of trying to get away from emotions. And I think that is because emotions come unbidden, or they're not in our control. They're an automatic process. They're given to us by genetics and biology because they help us survive, but they're not under our control. So that we don't like having things that happen to us that aren't in our control. And then in the Western culture, which is highly oriented towards control, having emotions is seen as weakness so often. And I have many studies of students who have studied the process. If people talk about that, they feel their emotions will kill them, that they'll drown, that they'll disintegrate, that they're tremendously afraid. And that this is one of the greatest difficulties. That somehow throughout life they haven't been given an environment in which they've felt that if they have emotions, they'll be able to be soothed by others, and that they'll get to survive the pain and not die. And so there's a great fear of emotion, and it's somewhat cultural, and it's somewhat because we can't control what we feel. It happens to us, and we don't like things happening out of our control.
And I'm assuming with the EFT model, when we get to know it, feel it, heal it, it also brings us the experience of we have some management and control over our emotions. That when it arises, that we can welcome it, we can get to know it, it automatically might bring down the fear because now we have tools to manage those emotions.
Exactly. So it's really a different way of managing the emotions by approaching them rather than by avoiding them. And it's been shown now definitively that when people name their feeling, their arousal actually goes down. So an experiment was done where the group was broken into two groups to touch a spider, and they were afraid of spiders. And one group was asked to just try to touch the spider. The other was asked to try to touch the spider and name what they were feeling. Well, the group who named what they were feeling 2 weeks later had less physiological arousal, were more approaching of the spiders, and the more words they used to describe their fear, the more they were able, the lower their arousal was, and the more they were able to approach. So somehow if we name a feeling, it begins to give us some way of managing that feeling. That's just the beginning, right, of the process of approaching and accepting feelings rather than trying to shut them down.
One more question. How do you approach people who are under-regulated and over-regulated? Does EFT approach both this group of people the same, or are there any differences?
So before you answer the question, let's open it up for our audience, because we utilize terminology that we as therapists understand, and necessarily you might not know what we mean by underregulated and overregulated. So let's first open it up. What do you mean by that?
Sure.
So that the audience is with us as we go answering this question.
Sure. Well, underregulated meaning that you see people are impulsive, whatever feeling they have, it's all over the place.
So it turns into action immediately.
Yes.
I want it, I'm going to get it, I don't care.
Yeah, you see the feeling flowing easily from their body. And over-regulated are more people who are
stiff.
And holding it in and don't show how they feel. Are there any differences in treating, or EFT has different approaches with these two different groups?
Right. So it's like if people have too much emotion and they feel overwhelmed by it, you have to help them first down regulate, how you use that word again. You have to help them reduce the emotional intensity, right, of how strong it is. And the important thing, though, is to be thinking about what emotion is too much emotion. So let's say someone has an anger problem. They get too angry. The thing is that's a secondary symptom. Probably that person feels shame or powerless. And they don't feel too much shame or too much powerlessness. What they're feeling is too much anger. So we help just tolerate the anger, but then we go to the underlying feeling. And once you start going to the underlying feeling, the anger disappears. And so in many cases, when there's too much emotion, it's too much of a symptom. And that symptom helps you to get away So I think one of you mentioned, like, people drink in order not to feel their shame or their anger, or they do one thing in order not to feel another thing. So in many cases, the very reactive emotions are helping people not feel the more underlying painful emotion. So, the message in EFT, which is difficult, is that people need to face their painful emotions, and that avoiding them in the long run is not going to be a permanent solution. But in order to face your emotions, you need a supportive, empathic, caring, actually, therapist who really helps you with this. But so we do different things with people who have too much and too little, but in the end it all comes down to the same thing, which is to help you face your painful emotions and get through them.
Yeah. So how do you apply that to, let's get to EFT couples a little bit. How do you apply this theory to EFT couples therapy?
Well, a couples therapy is a little different because the problem that you're coming in with is couple distress or marital distress. So you're not coming in with symptoms like too much anxiety or that you're depressed. You're coming in with couples conflict usually. And I mean, there may be additional problems, but the patient is the couple. And so what we're trying to do there is help couples reveal their vulnerable underlying feelings to each other, because usually they're expressing secondary reactive emotions to each other, often blame or a kind of distant, cold way of being. And so couples often get into negative cycles where the one blames, the other defends, one attacks, one defends, one controls, the other submits. And get interaction that people get locked into. So we're going to try to change these negative cycles by having people really show up in the couple and really reveal their more underlying self to each other, which is usually fear or feelings of shame or inadequacy. And we're not seeing those problem feelings. This is just being authentic. Like, for 45 years, I've taught this approach, but with my wife, when I was in a conflict, it was often very difficult to say, I feel afraid, or I feel inadequate or ashamed. I'd much rather criticize her. And that's what happens in couples. You tend to attack and defend rather than actually disclose how the life goes.
Yeah.
So in couples therapy, we're going to help people become more real with each other.
Do you also bring up, after you feel that there's a creation of safety there, so assumably when the couple comes into the room, they are expressing their emotions and thoughts, but they're the secondary ones that are usually on the surface. So as I'm hearing, you're working with also creating some source of a safety there, but do you also bring the primary emotions out when there's a safety in the room between the two?
Yes, I mean, so the first steps, we have a stepwise progression, of the treatment. The first is to create enough safety in the room. And some of the safety comes from the therapist validates each person and understands each person. So at least you feel you're being understood, but you're also being protected by the therapist. Even if somebody starts attacking or blaming, the therapist will help guide them towards their more underlying feelings so that they're not attacking any longer.
Right.
slowly the couple kind of soften up the ground until they are ready.
Wonderful.
Actually, be vulnerable with each other.
That's great. Now, I know that you are coming to Los Angeles for 2 workshops. One is, both workshops are for therapists, right?
Yes.
Yes. So the audience will be therapists. For all of you therapists who are joining us, know that there's Dr. Greenberg is coming to Los Angeles finally. So tell us a little bit about the 2 workshops. One is to treat individuals, and the other one is to treat couples.
Yeah. So there are two days workshops. The first 2 days is focused on EFT, working with individuals, February 17 and 18, from 9 o'clock to 4 o'clock. The other 2 days is Monday and Tuesday, February 20 and 21st, again 9 to 4 p.m. And for therapists who need CE hours are available as well. And
can you also
wait for that?
Right, where can they go to register or get more information?
Yes. To register, you can go to www.familyconnectioncounselingla.com.
FamilyConnectionCounselingLA.com. That's a long website. Family Connection CounselingLA.com. Great.
Yeah.
So it's exciting to have you, Dr. Greenberg, in Los Angeles. What would you like to let our audience know about the 2 workshops?
Well, I think it's interesting because in a way they build. It's often helpful to do the individual before you do the couple. And in the couples, there's not as much emphasis on really how to help people get to their real emotion. It's more focused on the couple interactions, but not as much on really how to work with emotion. So it helps us to the individual before the couple. In the individual, we use a lot of videotapes to demonstrate, and these are introductory workshops. So they're not experiential, and they're usually for larger groups. And the focus, though, is individually on transforming emotions, how to get people to their core painful emotions and how to change them. With the emphasis in couples is on revealing your emotions to your partner and responding to the emotions that are revealed. So there's a different emphasis in each.
Wonderful.
So your recommendation is to take both, to have the individual as a base and then the couple as the part of the whole theory.
Especially when, if you are seeing couples in your session.
Yeah.
Thank you so much for being with us, Dr. Greenberg. It's a joy, and hopefully when you are in Los Angeles, maybe we'll have another opportunity to have you in the studio for our audience to connect more, if that's a possibility for you.
Yeah, we can't wait to have you here.
Thank you. Thank you.
Thank you, and thank you, Ladan, for having this opportunity and creating this opportunity for us and our audience. And any last sentences that you want to say about it? I know you're excited to have him here.
Yeah. Sign up for the workshop.
Yes.
You are not going to get such a workshop anytime soon. This is a great opportunity. I traveled so many places to be able to learn from Dr. Greenberg, and since then my practice has changed totally. I get people that want to come see me, and it's all because I'm learning. I'm still in the process of learning from Dr. Greenberg, and I want every therapist to experience what I experience. It's not only going to change the life of your clients, is going to change your personal life as well.
Wonderful. Well, thank you for joining us. Thank all of you for joining us. And until the next time, create a wonderful world for yourself and others. Bye-bye.